Hey guys, Branch Brown here, physical therapist, CrossFit coach, and wellness coach with Get Your Fix Physical Therapy. Continuing on with the anterior hip pain or hip flexor strain, not necessarily going into a cause or treatment today, but something that you want to avoid doing. So anytime there's any sort of injury or pain, hey Scott, how's it going? The body naturally compensates for whatever is going on. Whether this is a conscious compensation or a subconscious compensation, it happens. The body naturally is going to do what it can to avoid pain. The problem is, hey Hector, nice to see you. Hey Nick. The problem is, hey Cameron, when you compensate, whether it's running, squatting, any sort of movement that you're doing. If you're compensating, if your movement pattern has changed from your biomechanics, then something else or many different things are moving differently. So if you change your stride, if say you can't extend as far back because you've strained your hip flexor, you've shortened your stride, therefore other muscles and joints are not working as efficiently or effectively. So you have this interaction between areas of the body that aren't working as effectively, and then over time, if you continue doing that, it causes other compensation injuries. So it's not uncommon for me to see someone, I'll actually just use that hip flexor for an example, with a hip flexor or anterior hip pain issue, but then when I get down to it, we start talking or I start working on them, and 3 weeks ago they hurt their back. So naturally that body's compensating and it's causing other things to happen, other things to move differently. So it's not, the way I like to explain it to people is it's like layers of an onion. As we start peeling things away, we find that ultimate cause of the problem. Whether you realize that you were doing something to cause this multiple compound effect or not, your body has done that. So something to think about if you are nursing an injury, if you are trying to just run through an injury or compete through an injury, really think about whether that's a smart thing to do. Think about if you maybe should just be lightening your load, if you're lifting weights, if you should be shortening your runs to a pain-free, or can you just really focus on maintaining your good technique? Yes, good call, Cameron. Or can you just think about changing your ultimate, or just really focusing on your technique to avoid those compensations? But the more you compensate, the more likely you're going to cause some sort of injury elsewhere in the body, whether it be down the chain or up the chain. Something is going to happen somewhere regardless if you keep putting it off and keep avoiding an injury or keep just ignoring pain and trying to fight through it. So something to think about if you are dealing with any sort of issues, especially in that hip flexor area, because the more you compensate for that, the more likely you are to either strain something kind of in your glute region, cause more of a sciatic type pain, strain the back area, the other side, or down the chain you've shortened your stride length, so now your lower leg muscles take an effect as well. So something to think about if you are dealing with any of these issues. And then, let's see, I think tomorrow I'm starting with some treatment stuff or exercise ideas for you guys. I could be wrong on that though. So stay tuned for the rest of the week. I will definitely be getting more on this to you. If you have any questions regarding what I've talked about today, feel free to post those below. If you're watching this on replay, I'd be happy to address those. Hey Dane, long time no see. If there's anything specific you're dealing with that you want answers to your questions, feel free to post those on here as well, or feel free to reach out to me directly regarding those issues. So hope you're having a wonderful Thursday, and I'll talk to you guys again tomorrow. All right, bye.